talked a little bit about, I'm going to jump around, talked about your staff and how fantastic they are.
They're great,
and
yes.
They can see your patients. Like if somebody's coming in for the first time, what do they expect?
From them or from me?
Or
from
like
everyone?
if I'm coming in as a
Yes.
patient for the first time, what should I expect?
Yes, so again, we try to be as thorough as possible. So you'll have to fill out a detailed questionnaire, and we go over literally everything possible in your history that could possibly account for why you're losing your hair. Okay, so it's very detailed, and it's really important because, again, there are so many reasons and things that affect the hair cycle. And so you'll fill that out. I'll review that, and I'll go over that with you in detail when I see you. We'll then do a detailed scalp examination, and then I'll determine if you need further laboratory workup and or need a biopsy. If you do, then we will conduct those things. If you don't, then we'll talk about your plan, and we'll go over all the medical therapies. I usually don't do monotherapy. I usually do multimodality therapy because everything that we recommend, they act synergistically because they have different mechanisms of action. So you want to do everything possible to focus on the hair. And sometimes I just deal with stress and anxiety, right? And so we talk about that as well. And if you need a hair transplant or platelet-rich plasma or exosome therapy or other therapies, we will go over that in detail.